Hello, everyone, and thank you for stopping by Miss B's Corner once again. Y'all just don't know my struggles this morning. This is like the third time I'm trying this, so they say the third time's a charm, right? Okay, first time I didn't have enough space on my camera, so I did a whole video. I did a great job and it didn't record. Second time I look at the video, my head is cut off. Part of my head is way up on the top of the video. I'm like, I'm not gonna post something that I know that my head is cut off. So I'm doing this again. And hopefully I'll get it right this time and I will say these words right because I've been saying these words all for the last hour or so. But I'm going to get them right. Okay, thank you, thank you, thank you, thank you. I appreciate everyone who has stopped, who've clicked on my videos, even if they didn't stay. Those of you who have subscribed, those of you who have liked, and those of you who come in on a daily basis, even though you may not, even though you may not comment. I appreciate it. I just thank you. The comments are really just our interaction, just to let YouTube know that my videos are serving part of the community and that it's interesting to people, and this is something that people want to see and they value. So if you could just like and subscribe, I'm asking early. So that way, even if you click off of here, just like and subscribe. I'd appreciate it. They tell me that they're still there within 30 seconds, I'm doing good. So just, if you're still here at this point, thank you, thank you, thank you. And I will get into what I'm going to talk about. So today, I did a video, my last video talked about cuts to Medicare, Social Security, and Medicaid. So I think a lot of people, or some people, were, of course, they didn't agree with me, which is fine. You don't have to agree with me. We're not, I'm not here for you to agree. We don't have to agree with each other in order to do this. But what I wanted to do was explain a little more on what I see as the cuts that are coming. There are cuts coming to some of these programs. Some of them are disguised and some aren't. I can't help that. I'm sorry. So there are cuts coming to these programs. So I will go through the cuts that are coming through Medicaid, the proposed cuts for Medicaid, and how they will affect things for Medicare, because those two programs are kind of interconnected in ways. And a lot of you, if some of you have Medicaid and Medicare, you know it. If you don't, this is an education for you as it's an education for me. I just want to say that I am not a professional in any of these fields. I am just like you. I am learning. I am the curious one. I like to, once subject interests me, I'll look at, I'll do some research on it. I'll look at it. I'll read it. I'll go watch some things about it because I'm just interested. So I like to, how can I say, I'm not a small talker, but I can talk about subjects. So I always like to have things for subjects, but also in my normal work life and whatever, I was the one who, I start a job. You tell me my part of the job, which is fine, and I'm going to learn what I do. But I also want to learn what's done before me and what's done after me. So I want to know the whole scope of the job, because sometimes your piece is a piece that maybe doesn't make sense to you as you're doing it. But if you know what comes before and what comes after, you can maybe make suggestions to make the whole process more cohesive and better. So that's who I am. So I have done a little research, and I wanted to just bring that information to you guys. Also, I have notes, so you will see me looking down. I will try and put my paper in a position where I'm not looking down a lot reading, but I will have to refer to my notes because this is stuff I don't want to get right. So Medicaid and Medicare. Medicaid is a partnership between state and federal government, which covers low income individuals between 0 and 64. So I say 0 because they cover babies. It covers babies. And there are children's programs, children's medical programs that are funded under Medicaid, as well as there's Medicaid for adults who don't have any other health insurance, who aren't working or low income. I don't know how you qualify for it. That's not what this video is about. But also under Medicare, that is for individuals who are 65 and older. You are required, with certain exceptions, to sign up for Medicare. So, and some individuals who are on Medicare also qualify for Medicaid because they are low income or they don't have a large income or something. So they are also covered under that Medicaid, and this is where we're making the connection today. So so I'm just reading, and the first thing they said was any cut to Medicaid is a cut to Medicare. Over 12 million people with Medicare rely on help from Medicaid under a program called Medicare Savings Program. What does the Medicare Savings Program cover? It covers, one of the big things it covers, something that Medicare does not cover it, but Medicaid does, is long-term nursing home care. So most of your seniors who may be in a nursing facility and they're not able to pay the bill on their own, they can't afford to pay the bill on their own, they are covered under Medicaid. Although they have Medicare, they're also that portion of their that's being covered under Medicaid, as well as the Medicare savings program under Medicaid also helps with family care support givers. So people who help to support their family members in the home, that, if they don't send them to a nursing home, or they're taking care of them at home, or I think sometimes maybe the home health aides and the such, and to get somebody to come into the home, that is also covered under Medicaid, not so much Medicare. So that is one. Those are things that are covered. As well as there is a premium when you sign up for Medicare. There is a Part A, which basic hospital coverage, that's free. Part B is your doctor's visits, which has a premium. You have to pay $185, or I say $175 to $185, because it depends, I think, but anyway, yeah, it depends on who you ask, but it's between $175 and $185 that you pay monthly a premium for your Part B. For most seniors, I can say that that Part B premium is taken out of your Social Security check. So that is you get your Social Security minus Part B. And for people on Social Security whose Social Security is not very much, that Part B, that $185 or $175, that's a lot to come out. And you know, that's a lot. That's the difference between food. That could be the difference between, you know, groceries for the month, a bill for the month or something. So it's, they're not able to afford it, and especially they had low, you know, they don't have any income and their Social Security is very low, and they don't have any other thing that they, you know, they don't have 401ks, Roths, pensions, or anything like that to help. So that's where the Medicare savings programs helps with Medicare. People, Medicaid pays that premium for people. Also, they pay some of the copay services when someone under Medicare goes under their Medicaid Advantage plans. They can pay some of those costs as well. So now we're talking, there's another cost that they're paying. And this is a senior that doesn't have to put out that money to pay the extra that they might have to pay for x-rays or MRIs or something like that. Medicaid pays that if they're qualified. They also help with prescription drug costs. We know prescription drug costs are very high. And for some people, and depending on their situation, so now Medicaid will help pay that also for people who are receiving Medicare. So we have people, there is a term they call dual eligible for people who are eligible for, who get Medicare, and they're also eligible for Medicaid. So those are your dual eligible people. A lot of the Advantage plans will, you know, are specified for dual eligible so that all of that stuff is covered. And also with your, the premiums, that you don't pay the premium. Those are things that seniors will be affected by, most definitely. Although it's not a direct hit to the program of Medicare, it is taken away some of the services, some of the things that Medicare does that is covered by that are covered under Medicare, that the senior may not be able to afford later on. So you get hit with more fees. It's an indirect hit for some people, but it's a hit. It's not a cut, it's an increase for you, more or less. It's a cut someplace else, but then it becomes more fees for you on the back end. So that's when in my video I was saying that they're cuts. So there are going to be cuts to Medicaid, and those cuts to Medicaid will affect Medicare in different ways for different people who may be on those programs. So the information where I received it, I also am going to put in my description the link to Medicare Rights, which is a website where I got a lot of information, and they give you a telephone number where you can reach your lawmakers and complain. Complain about these cuts that they're going to do, as well as I put a link down for the Medicare savings program, where on that particular site, it also explains the whole program. And there's several different ways that you qualify, which I wasn't going to go into that because that's not what my video is for. And you can check and see if you're eligible, and you can apply to see if you're eligible for savings on any of those programs. So I would suggest that you do it, although they're going to do some cutting. There may not be, we don't know when those cuts are going to happen, how they're going to happen, but just that they may happen. So I say if you think you're eligible, go ahead. You get a little relief for maybe a month or two, and then you have to go back to paying what you're paying now. But definitely, because the states will change how they fund their Medicare, most definitely. And both of those articles talk about that the states, they may decide to do work program, making sure work requirements and things like that in order for people to get the aid. So they'll cut a lot of people off based on that. And what I did was I saw a comment from someone on the Medicare Savings Program website on their article, and their comment, it kind of struck me because I was trying to say this the other day, and people a couple of people, I don't think their idea was not my idea, because I said almost these exact things or close to it, but that the cuts were going to come. So this poster says, I am on Medicare and Medicaid, as well as Medicare Savings Program, where Medicaid pays my Medicare premium. That was one of the ways that you say that they help you out under Medicaid. If this program is cut, then I would not be able to afford the Medicare premium, and I suppose end up without the Medicare coverage. That's unfortunate. I hope that doesn't happen to her. I hope it doesn't happen to anybody, that people would not have medical coverage. There should be another way that we could do this. Unfortunately, I am totally expecting to lose this much needed health coverage. That I really hope that doesn't happen. She goes on to say, I am also expecting to lose my food stamps, my SNAP benefits, as well as my HUD housing coverage. And I did say in my last video that HUD housing cuts are going to come. We don't know. I don't know how, and I haven't seen anything of what the proposals are. Of course, I'll go and look, because I think those are things that a lot of seniors will also be affected by, the HUD cuts, because a lot of seniors are getting subsidized through HUD to help pay for their housing, especially those who live in senior complexes and everything. A lot of those senior complexes were built with HUD money. So, and were HUD funded. So we're going to say that, we know that those cuts are coming, as well as the SNAP benefits, the food stamps. And I would hate for people to lose their food stamps as well, because it may be the only way that they're eating right now. So I just wanted to bring this information once again. Hopefully it's a little clearer now. And I hope I did a better job than I've been doing, because I did this video 3 times. But that's me. That's the non-perfectionist in me that says I can't put that out, because that's just jumbo. But anyway, so thank you guys for stopping by. Please like and subscribe to my channel. If you've made it this far, that means this information was valuable to you. And come back for more. Okay? Well, I thank you once again, and I'll have a wonderful day.